There are some ways to minimize or negate it, particularly if there's constipation. Here in the clinic, we have something called Motility-Zyme, which is by a company called Biotics that was actually specifically developed with GLP patients in mind. And it's a combination of max citrate and some other ingredients that can help with the peristalsis, or basically help promote the movement of stool through the system so that there is less likelihood of constipation and or nausea.
If I have a history of constipation and I'd like to start a GLP-1 medication, what are some things that I can do in prep prior to starting this medication?
So it's really, really important to stay well hydrated. A lot of people are either minerally depleted and or electrolyte deficient, and both of those can have a big impact on alleviating or reducing the risk of constipation. For some of my patients that have had a significant history of constipation, I actually do recommend a very gentle, basically clean out before they start, because if you're already constipated and you start tirzepatide, it can be extremely uncomfortable, and some patients actually would want to potentially stop the medication just due to the constipation. Looking at your dietary intake, for example, are you having enough fat intake? Are you having enough fiber? Are you having enough carbs? There's things in dietary history that we can look at to make sure that you do well on tirzepatide while also reducing or negating or minimizing the chances of complications or side effects with the drug.